shirt says, Dad, superhero, a referee, legend. So, It all started with a visit to my primary care physician. Blood tests came back, results he didn't like in terms of certain levels of testosterone. Go to a specialist. He says, no, you don't have any issues. I wouldn't suggest doing any treatment. My primary care, he didn't like that answer. We go to a second specialist. Let's get a CAT scan of your head. So we make sure some type of pituitary gland or something is not related. We got your results back or no issues. However, we do see a large mass the size of a golf ball. The minute I received that information from the second specialist that I had a brain tumor, I went numb. It's like, the way I've seen in life, I come from a side of strong Black men that keep everything inside. Playing sports, you have to come prepared to whatever life serves. When life serves you something difficult, you just gotta treat with optimism and the best way you can. So, 2 seconds left, you have one opportunity, 3, shoot, it goes in. John Hopkins is basically just a major, entity regarding anything medicine. It was a no-brainer. It was like, hey, how's it going? Good to see you. Basically what Michael Jordan is to basketball, Dr. Brem is to brain surgery.
When a person comes in with a diagnosis of a brain tumor by an MRI, the first question we ask is it inside the brain, an intrinsic brain tumor, which is the most common type, and that's usually in the glioma family, or brain metastases inside the brain? Or is it outside the brain but inside the skull, pushing down on the brain? In that category of tumors are meningiomas. So in his situation, it had the characteristics of a benign tumor. If that tumor was located in the middle of the brain, the frontal lobe, it's actually very simple and very low risk to remove. One of the challenges in removing a tumor at his location is its adjacency and pressure on a main draining vein of the brain. So the location pressing on that vein was the challenge in removing the tumor and the difficulty. And also, that was the challenge in leaving the lung, because sometimes, about 1/3 of the time when a patient sees me with a benign tumor, we just watch it. We see, is it growing? Is it causing a problem? His situation was because of the relationship to that vessel, it needed to come out in order to prevent a stroke from compression of that vessel.
16 to 18 hours away from the scheduled surgery, brain surgery tomorrow. It got close to surgery and I went out and was looking for stories and trying to figure out what the actual operation consisted of. I was looking for hope. 5:40, 10 minutes late, but we're here, we in the building. After story after story, even though it was valuable, I didn't see anybody of color that I could relate to.
I did do a little bit of homework. Yeah, you brought up an issue, so I want to show you this. You asked about, do Black people have meningiomas? Here are the actual numbers. I'll give you this. So if you look at the incidence per 100,000 people, Blacks have 11.35 meningiomas per 100,000.
So in terms of data, we know that meningiomas are more common in African Americans than the general population. And we also know that, at least historically and nationally, African Americans have worse outcomes than counterparts in terms of a longer length of stay, greater complications, and there seems to be a trend that they might have earlier recurrence of their tumors. There is data from our institution over the last 5 years where we've deeply looked at some of those trends and outcomes, And we've seen that actually our outcomes amongst African Americans and minorities is actually equal to the general population. And from a research perspective, historically, we've been one of the largest academic centers looking at this work in disparities in access to care and outcomes of care in neurosurgery and broadly in medicine. There's good data that shows that when patients feel seen by their healthcare systems, they have better outcomes.
All right, we're gonna get through this, so I'll see everybody in 6 hours. Post-brain surgery life. Hi. Hey.
This is the scar right here. A scar of appreciation, gratitude. What matters to me now most, relationships that are meaningful. It's important that you touch them and have conversations with them, knowing that I'm not alone in this. And when I do have different challenges that show up, I can share this information versus thinking that I need to keep this tight chest and fight the battle by myself.